Okay, Sandeep, start.
You can start, sir.
Hello, doctors. Welcome back to our Oracle 21 Days Revision Series. So today we're going to talk about mycology topic today, mycology topic 1. So now we will see what are the things important here. So the first thing what we are going to discuss here is So these are the questions we will be discussing. So here you see dimorphic fungi, very important one, frequently asked. It can be asked easily for 10 mark question. Okay, very, very important 1 mark also. Every exams in NEET PG or FMG exam, everywhere dimorphic fungi, one question is always asked. Slide culture, yes, important. Sabro dextrosugar also, important short notes. Fungal infection of hair, this is not that much asked, but it's okay. It's better to know. Okay. Dermatophytes, yes, frequently asked question. This is repeatedly asked question, important. And when you talk about dermatophytes, under that only tinea capitis, trichophyte, and everything will come. So this is almost all the same topic only. So we will discuss now everything in detail. So, so you know that what are things we are having here. Or I choose Auricle because of all the recorded classes, live classes, practical sessions, exam module, and the hard copy sets we have. You know that. So foundation classes are there, live classes are there, express exam module is there. You know about it. One-to-one doubt clearing session, hard copy sets we have, and question bank also. Good practical session also you will have. This is a subscription plan. You can check whatever is comfortable for you and choose accordingly and make use of all the things. Okay. Yes. So the first question is the first question is about dimorphic fungi. So when we talk about dimorphic fungi, so we are in fungi, bacteria, virus, all over, parasite over. Now fungi, we are here in fungi. So when we talk about the fungi, so usually what happens, fungi mean they exist in both. Usually a fungi, any fungi, it should be yeast form or it should be the mold form. That's it, right? So but here dimorphic fungi, they exist in both the forms, yeast and the mold. The yeast usually at 37-degree body temperature, and mold is usually the room temperature, around 25 degrees Celsius, 20 to 25 degrees Celsius, they exist. So yeast means, there will be budding cells, there will be budding yeast cells, budding yeast cells will be seen, you can see. And mold means you see hyphae will be seen. So these both the things are seen in dimorphic fungi. Okay, first point. Second point, the most common organ is lungs. All the dimorphic fungi, the primary organ is lung. Lung is the primary organ of it. So if it becomes severe, then it will go to other part. If it becomes severe, then it will go to disseminate to all the bodies. Okay, all over body. It will go to all over the body. Excuse me. It will disseminate to all over the body and cause different infections. Okay, any can affect any organ, kidney, liver, heart, anywhere. Okay, that's it. So usually this is the clinical feature, common clinical feature for all the dimorphic fungi. Okay, that's it. In India, in endemic, when you talk about endemic in India, only histoplasma is endemic. Rest all almost we don't have, or very, very rarely, only when people travel from abroad, they can bring this disease. Okay, histoplasma. Okay, that's it, histoplasmosis. Okay, now what are the list? So when they ask a dimorph, the first thing you have to write about the list. That is very, very important here. Okay, so what are the list you know? Usually it is histoplasma, histo, histoplasma, histoplasma, and then histoplasma, blastomyces. Okay, coccidiosis, then coccidioides. Okay, and then we also have penicillium marnifi, or they call thalaromyces, okay, and then sporothrix shankai. Okay, these are the 6 organisms you have to know. Okay, you have to by heart it. It's very, very important. Okay, now, excuse, yeah. So now I'll go to individual picture and show you what are things here. Yeah, now. Yes. No, you can see. So this is the thing what we discussed now. Already told you all the dimer fungi. So in histoplasma, first disease is histoplasma. Histoplasma, the other name of histoplasma is also called as, very well, it is called Darling disease or Caves disease. That's the first thing important. Okay, Darling's or Caves disease. So organism Histoplasma capsulatum, which is very common in North America. This is very important. Where it happens for some disease, you should know the locality. Where it is endemic or epidemic, you should know. So this is endemic means it's always present in North America, Ohio, Mississippi River. Very very common. In India, of course, I told some places it is common endemic. Okay, Histoplasma. Okay, so usually the inhalation occurs through which one? Through bat. That's very important. In transmission of the birds, that is especially bat dropping. That's also question. Okay, bats dropping is the main reason. Clinical feature, same, it will mimic like a TB. Histoplasma means itself, it is looking like a TB only. It will be very much like a TB. Okay, now you have to diagnose. So diagnose, as I told you, you will have two forms. You will have a mold form and yeast form. Every dimorphic has everything for both dimorphic fungi. But for some bacteria, only one is enough to diagnose. So for histoplasma, you have to do both. When you see a mold form, you see, look at this picture, it will look like a tuberculate form like this. So this is the fungi, and then you see all like this. So it is basically like a tuberculate form. That's it. Okay. So TB can TB tuberculate. It sounds similar, no? So remember like that. Okay. Yeast form. They have the narrow, tiny yeast cells. You see inside the cell, inside the our macrophage, you can see small cells like this. Small budding is a tiny, very tiny budding yeast cells you can see. That's all. This is for your histoplasma capsulatum, the number one. Number two is your blastomyces. Blastomyces is blast. Okay, blast. So it's also called as Chicago disease. They call Chicago disease also. The causative agent is blastomyces dermatitis. Here, main thing, you don't diagnose the mold form, only yeast form is important. So yeast will look like a bee. So blastomyces is a bee. So broad based, you call it as broad based. So it will be like this. The cell will be like this broad. Okay, the budding itself will look like this. Okay, so you can see here the picture. So figure of eight appearance of broad based budding cells. You see, that's it. This much only. Clinical features same. Everybody causes lung infection, pulmonary infection, disseminated. It goes all around, cause any disease. Okay, that's all. So this is for your this thing. Next. Now, this one, coccidiosis. In coccidiomyces, coccidiomasis, otherwise called desert rheumatism or San Joaquin Valley fever. Okay, valley fever. We call it valley fever. So, causative agent is coccidiomasis immitis. So, here also you will have pulmonary infection plus arthralgia and erythema nodule, which means it is looking very similar to your rheumatic fever. Okay, rheumatoid arthritis, whatever you can say. Rheumatoid arthritis would be the right word to say. Okay, rheumatism. So, here in this case, you see here the mold, we have mold and we have the yeast form. The mold form is usually barrel shaped. You can see here now this picture, it is like a barrel. It will be like this, arthrospore or barrel shaped arthrospore. You call rectangular or barrel shaped arthrospore, it will be like this. Okay, now yeast form, it will looks like this, exactly like this. This is a spirule. You call spirules with the endospore, spirules with endospore. That's it. Okay. Now the last one. In paracoccidiosis, South American blastomyces, the causative agent is paracoccidiosis brasiliensis. Paracoccidiosis brasiliensis only. So here again important. Here the yeast form is only important. Mold form is not that important, significant here. So you see like this. You see the pilot or Mickey Mouse and pilot or mariner wheel. So this picture is a mariner wheel. You see it's like this. All things like this. Mariner wheel. Okay, call it as a mariner wheel, round like cartwheel or mariner wheel. And this one you see Mickey Mouse. This is very much like a Mickey Mouse. That's it. Okay. That's all. Now, Penicillium thalromosis caused by Penicillium marnifi. So here main thing is that reservoir is bamboo rat. Usually say it comes from bamboo rat. So infection in the HIV patient, usually very bad skin lesions they can have, and even hepatosplenomegaly is common. So other one is that how do you diagnose it? So diagnosing you can see. So if you sabrodextrosaga, you see greenish gray colony, but on reverse side you see red colony. This is the one. Reverse side you see the red colony. That is one point. Okay. Then LPCP you broomstick or paintbrush appearance. You can see this broomstick or paintbrush appearance. This much only. This is a very important point you going to hit here. Okay. That's all. So and one more left is your sporothic chancre. We will talk the sporothic chancre now. So this is just protection, otherwise called rose garden disease, and it's very important. This question itself can be a short notes directly. They can give you 5 mark question also, 1 mark question also they can ask directly, because examiner they love sporothic chancre. It's common scene. Okay, so sporothic chancre due to traumatic implantation, thorn prick, implantation, whatever comes, and ulcerative lesion along the lymphatics means it is definitely sporothic chancre. So it's a pulmonary infection. It causes in endemic. It's usually endemic in hilly areas. It's very, very high, rose gardeners. So here you see yeast form in the, this is a disease, how it looks like. This is your yeast form. In yeast form, you see something called sugar-shaped sugar bundle. You can see the sugar bundle appearance, or the phenomena, entire phenomena, you call it as a asteroid body. Okay. Now, splendor Hopley phenomena, that is again seen this, the phenomenon here itself is called as a splendor Hopley phenomena. And in the mold form, you can see this rose-like conidia, okay, flower or rose-like conidia. That's it. This much only you see. Okay. Treatment, you can give itraconazole or potassium iodide with systemic amphotericin B, whatever. Okay. That's all. This much for your sporothrix shankai or rose conidia. So this is a dimorphic fungi. So easily you can get mark in this one. Okay. Yes. Now, slide culture. Slide for fungi, you do a slide culture. That is why we do slide culture means to sometimes you want to see the spore formation, especially this conidiospore. We call it as the conidiospore. So we especially do it to so you show the conidiospores, this one conidiospore, and the way in which the spores are produced. So that way we can identify the species. Okay, that's what we do. The slide culture. So for slide culture, we use the cornmeal agar or potato dextrose agar. Cornmeal or potato dextrose agar. What is the method? Method is very simple. You can see here. So we see the picture. This is exactly what we're going to do. We are going to, yeah. So first of all, what you have to do is that you will be taking a, so this is the slide, this is a cornmeal agar. So first of all, you are cutting a block, you're taking a slide culture means you're taking a cup, this is a cornmeal agar. So from the cornmeal agar, you took a piece of agar. You took a piece of agar, okay? And then what you're doing that piece of agar, it's very simple technique. You take a cover, you take a glass slide. So on the top of the glass slide, you're placing this agar, okay? You place the agar on top of it like this. You've placed it, and after that, what you do? From some colony, whatever colony you want to see, either yeast or mold doesn't matter. So you take that one. So this is your culture, and then this is your slide. Okay, now what you do, you pick the colony. So whatever the colony you're seeing now from this one, so you pick the colony and put it on the side, only on the corner of the thing, corner of the agar, you put it. And after that, what you do, you take a cover slip, you take a cover slip, this, and put some other color. Yeah, you take a cover slip like this. See, take a cover slip and put it on top of it. Okay, this is a cover slip. You're going to cover it on top of it. That's all. And then leave it overnight incubation. And next day, when you see under the microscope, you will see the conidiospore. Okay, after this, you have to incubate it, incubate overnight. Okay, incubate overnight. So usually for 24 hours is enough. And next day, if you see, you'll see the spores are formed very well. You'll see the corner. Again, you'll see in the corner of the slide only. So that's what we call slide culture, because we're doing it on the slide. You're doing the culture. We are doing it on the slide. You're culturing. That's what it's called, slide culture. Very simple. To see the spores are formed properly or not. That much only. Okay, very, very easy. Easy technique. Okay. Now, next. Now, your next question. Sabrodextrosagar. Sabrodextrosagar, very important. It's mandatory to know. Okay. Why we have to know? Because you can see this sabrodextrosagar, it is for growth of the fungi, any fungi. Okay. It's a culture media for any fungi. Okay. So both it can be yeast, it can be mold, both will grow on the sabrodextrosagar. Important thing is the pH. The pH of this is 5.5. It's a 1 mark question. So 5.5 to 5.6. Okay. 5.5 you remember. So what are things it contains? The name itself says dextrose and agar. So it has dextrose, peptones, and the agar combination. And the low pH is because it is very important to inhibit the growth of other bacteria species. You prevent other bacteria growing, then only fungi can grow. So unnecessary bacteria will be inhibited. So it facilitates the growth. So this is exactly your Sabbrodextrose agar. It's a yeast form. You can see the yeast. Yeast means, it's basically the candida which grows there. So that's all. This is for your Sabbrodextrose agar, SDA agar. Okay, that's all. Now, fungal infection of the hair, otherwise called Petra. So here it's very easy. You can see that here Petra, basically, so we have two things. Fungal infection of hair, either it is Petra or it is ectothrix or exothrix. Ecto or endothrix. Okay, this is endothrix. I'm sorry. We have written, no, yes, this is ectothrix and endothrix. We have two things, okay, endothrix. So now Petra means hair shaft infection. So you have your hair. So if this is your hair, the infection is on the shaft, okay, it's on the shaft. So what happened, usually it can be a white Petra or a black Petra, like some lesion, like a nodular lesion. You see nodular lesion, like a nodular lesion you can see around the hair. Okay, that's it. So it can be a white Petra or black Petra. White Petra is caused by Trichobitum bejeli. Black is caused by Petria hortiae. Okay, hortiae. That's it. This is only. Okay. Now, what about ectothrix and endothrix? Ectothrix and endothrix, basically another infection. This is basically hair follicle. There is a hair shaft. This also has shaft only, but you can say basically you're talking about the arthrospore. Arthrospore. If the arthrospore is outside, we call it as ectothrix. If it is inside, you call endothrix. That's it. So this arthropode things is formed by, you can see if it's ecto, adoni, canis, mentographites. Adoni, canis and mentographites. Okay, Audone, canis, and Mentographis. Endothrix, you have tonsurans, violation, sonlini. Okay, endothrix. Okay, sonlini, violation, tonsurans. That's it. This will be inside. That's all. This much only. Okay. Yes. Now, yeah, this is done. So now next one is your. I'm going to go to the next one. Dermatophytes. Dermatophytes means itself. You know that dermatophyte. They are basically other name for this dermatophytes is the infection causing it's called tinea, or we call ringworm infections. Ringworm infections. So they can cause anything. Usually the tinea can be tinea capitis, tinea corporis. It can be tinea unguum, tinea barbae, tinea cruris, tinea pedis. Okay, so these are the few things according to the location. So tinea capitis means infection in the head, corporis body, unguum finger, barbe it's on the face, no, face barbe, cruris, tinea cruris, again it's the groin region. We call Dobie itch, or this pedium is in the feet. So you call athletic feet. So these are the dermatitis. So it's usually, itchy ringworm infections are called dermatophytes. The common causative agent, if you see, there are three types. Okay, they are caused by trichophyton or epidermophyton, or they are caused by other one is microsporo. Okay, these are the things. Now, when you say trichophyton 3, so it infects what are things it infects? Infects the skin, hair, nail. Epidermophyton means epidermal skin will be there plus N. So nail, only nail will be there affected. Microsporon means again skin plus hair. That's all. Okay. This much. And then how they look like, I will tell you how the microcondia looks. Okay, this is a basic thing. You have to write these things first. Okay, tinea infection or ringworm infection and all different types of thing and what they're causing. You have to mention it. Okay. And after this, yeah. Now Uh, yeah, so this is exactly what I'm saying. So we already discussed, you see, trichophyton, epidermophyton, microsporum. One second. Uh, so trichophyton means all the three one, epidermophyton skin and nail, microsporum skin hair and this thing. Okay. So clinical feature is basically, say I told you, tinea capitis, scalp infection. In that again, you have two conditions called Favus and Kirion. The capitis. Favus means it's very like a crusty, scalpy form of scalp will be very scaly. Kirion means there'll be boggy swelling. It will be like a ball swelling. So the favus is usually caused by, this is one mark question. They usually ask in one mark. Okay, Schronleni, and Kirion is by mentographites and vericosum. Okay, vericosum. Okay. So barbe in the beard region, hungium, pedis, and cruris. We already spoke everything. Okay, jock, it's everything. Dobby itch or jock itch, you can say. Fine. Now that's all. So this is your tinea capitis. Now look at this next picture. This is very, very important. So how do you identify this thing means? Hmm. So this is how it looks like. So when you see here, look at this picture. You can see this is the one. This is the favus. So this is the favus. This is this boggy swelling. This is called the Kirion. Okay, Dobby itch, athletic feet. Okay, so now try how do you differentiate? How do you clinically diagnose? So when you put trichophyton, epidermophyton, and here is a trichosporum, I have to just push this. Okay, fine. Okay, so this is how it looks. So you, if you go to the one second. Yeah. So if you go to the this thing, trichophyton, here the mitochondria will be very abundant. Okay, mitochondria will be abundant in epidermophyton, and in microsporum it will be very, very few. The last one is microsporum. Okay, microsporum. Yeah, so it'll be few. Here I can't see. That's what I'm adjusting it. Macrochondria is very important. Macrochondria you have to know, very important question asked. Trichophyton is pencil shaped. You can see here all pencil tip. No, so like this pencil shaped. Okay, pencil shaped. An epidermophyton, it's a club shaped. You see here. This is the epidermophyton. The epidermophyton, it looks like a club. Okay, like this. You can see it's like a club. Spindle, microsporum is spindle. You can see here. It's like a spindle. Okay, spindle shaped microsporum. That's it. So these are the things very, very important. How does it look like? Okay, how when you speciate it, you speciate like this only. Okay, so these are different types of tinea infections, you can say. Now, yeah, tinea capitis, same thing. Whatever we spoke just now. So it's from same you have to write from the previous question. Okay, same thing from the previous question. Hmm. That's it. Okay, whatever we talked there, tinea capitis, same thing you'll repeat it here. And also one more question, trichophyton is there. That also same, almost same thing only you have to write. Clear all the drawings, yeah. So again, if they ask the word trichophyton, all the same dermatophytes only. Okay, it comes in a dermatophytes only. So here again, you will be talking about. You will say it's trichophyton means all the three things will be affected. Especially when it in tinea capitis, it causes the it causes, of course it causes all the tinea. It causes all the all the tinea infection, especially you can write trichophyton schonlini causes favus, and your mentographites and verrucosum causes kirion. That's it. And favus means crusty, scaly form, and kirion is a boggy swelling on the scalp. That's it. Okay, this much only. This much is more than enough to tell. This if you write this for short notes, so 5 mark is easy. Okay, so you can write it. That's all. So yeah, so we are done with this. So mycology is one easy topic. So you guys can easily, score in this subject. You can't make any mistakes. And the rest of the things we'll see in the next class. Okay, next class you'll complete the whole mycology. So good, you will do it. Okay. So that's all for today. Thank you so much. Thank you.
Sir, completed, sir.
Completed. Yes, Sandeep. Done.
Okay.
Yeah.
Thank you, sir.
No problem.